name is Busiso Hlachwago. I'm the Director for Business Development at Health Systems Trust, and I have the privilege of moderating today's session. It is an honor to host experts, funders, policymakers, implementers, researchers, community members who are united in the goal of improving access to essential medicines through robust digital health solutions. We stand at a pivotal moment where digital health is no longer just a luxury, but it is a necessity for efficient, transparent, and people-centered health systems. The CCMDD has demonstrated how digital tools, data, and coordinated supply chains can reduce stockouts, improve patient outcomes, and free up clinical time to focus on care. Today, we'll explore how digital health, as a cornerstone of medicine access in health systems, can be leveraged to strengthen health systems more broadly. We will hear from a diverse set of voices from policymakers, program implementers, private sector, HST, and representatives from the private sector as well on what works and what challenges remain and how we can accelerate learning and scaling up. I must emphasize that this session is aimed at discussing digital health and not necessarily promoting specific products. We have the National Department of Health are responsible for setting policy and direction, and we're grateful for Ms. Volmarans to be here. And they will be speaking to the role that the department is playing. And also HST will speak to the role of NGOs. And then you'll have a community representative that will speak on experience in terms of leveraging CCMDD. I want to emphasize this. It is important that the people that we serve have a voice and we listen to them, both in program conceptualization, and also during program implementation. It is important that we always have our finger on the pulse and we know what is being experienced or the experience of the people that are receiving the care that we provide. So in terms of this session, we will have a welcome by our CEO, the HST CEO, and then we'll have a keynote by Ms. Volmarans on behalf of the DG. And then after that, I will then request our 5 panelists to come up front, and they will be seated here, and then they'll speak to different aspects of the presentations. And then at the end, I'll request the panelists to have a group photo, and then also I'll request my HST colleagues to have a photo with the panelists as well. And then at the end of the presentations or the panel discussion, we will then have time for a Q&A. So you'll have time to ask questions and our panelists will then respond. So I think at this point, before inviting the panelists, I will request our CEO to come and give us the welcome address. Over to you, CEO.
Thank you, Spusiso, and good morning, everyone. It is quite a full room. Thank you for making the time to join us this morning. It is an honor for me to welcome you to this session. And as it has been spoken in many of the sessions at this conference, digital health is playing an important role in how we deliver services and how we manage patients. And it is at Health Systems Trust, we work in partnership with governments and communities to strengthen the health system. Our vision is to improve health access and outcomes in South Africa and beyond. This we do through advancing digital health interventions, as it will be demonstrated today during the discussions, conducting implementation science research, and building capacity of healthcare workers. This ensures that innovations don't just remain innovations, but that innovations translate into measurable improvements and improved outcomes in patient care. Established in 1992, we have over 30 years of experience in public health innovation. We have a proud history of supporting the National Department of Health and working with provinces and districts and other partners in the management of HIV and TB and other priority diseases in the country. We have been recognized over the years for translating data into action as well as influencing policy. This is especially through our very publicly known and well-recognized peer-reviewed publications in the District Health Barometer and the South African Health Review. And we appreciate all the support that we receive from all the partners in the country to compile these publications. We have over almost 1,500 employees, and we therefore consider ourselves to be an employer of choice for public health professionals. So today is a very important day, and it's a pivotal moment where digital health is transforming how we deliver care, as I mentioned earlier. NGOs like ourselves have a very important role to play in this space because we serve as the bridge between innovation and the large-scale adoption of these innovations. We support the testing of new service delivery models. We generate evidence, and we ensure that solutions are context-specific, that they are sustainable, and they are aligned with national priorities. CCMDD is an example of how a health program can benefit from utilizing digital health to improve access to essential medicines and improving patient outcomes. At this specific time where we're seeing major changes in the funding landscape, initiatives that aim to integrate care are proving to be priceless and are the way to go. CCMDD is one project that is an example of how HST supports government and communities through a patient-centered approach. We supported and are continuing to support the National Department of Health in the rollout of the digital health solution called SYNC, which supports CCMDD in 2,582 facilities out of the 3,954 across 31 districts in the country. CCMDD, I'm sure for this audience here today, I don't have to explain to you the advantages of it. It accelerates access to medicines by enabling smarter distribution of medicine, providing for convenience and leveraging technology for communication with patients. And it allows for better planning for both the healthcare workers as well as the patients, so that patients spend less time waiting in queues in our health facilities. So the message is clear, as it has been repeated all across this conference. Any of the, whether AI or digital health sessions, would have emphasized that the use of digital health, or AI as some call it, enables us to close the gaps in access to essential care delivery, and specifically for this case in essential medicines, which reduces inequities and improves adherence. For HST as an NGO, collaboration for us is paramount. And we would not have done all or given all the supports that we currently do if we were not part of an ecosystem that consists of multiple stakeholders. There is government, which ensures policy alignment, funding, and nationwide digital health scaling. We have funders, in this case CDC, who have invested into these innovative solutions, ensuring scalable platforms that have measurable outcomes. It is our hope that through this session and many more discussions and engagements that we're going to have, that more funders will join in supporting this initiative and in making healthcare accessible and a reality for the majority of South Africans. I will not forget our communities. These are the people that we serve, that we live amongst. Being on the ground has allowed us to co-create with them and obtain continuous feedback as we implement our programs, and to ensure relevance and user-centered design. As a partner, HST brings years of operational experience and excellence, working with amazing teams, a lot of them I can see seated amongst the audience here, and teaming up in partnership with the district's peers as well as the health facility peers. We are embedded in the communities that we work with, and this allows us to understand how digital health is impacting lives and making healthcare more accessible on the ground. This also enables us to communicate stories that are compelling and are shaped by the work that we do supporting communities and the government in implementing these innovative solutions. It is for these reasons that we hope to expand HST's support to more communities and that we can work with more partners than we currently do. It is very important that we work with partners to scale the existing as well as the new digital health systems. But what is even more important is that as stakeholders, we collaborate with the National Department of Health so that we create enabling environment for the scale-up of these digital health initiatives, ensuring that they are always aligned with the priorities of universal health coverage in the country. There is a need for investment into areas such as data quality and analytics to inform the national and provincial decision-making processes. We also need to build sustainable funding mechanisms, especially at this time. And we need to demonstrate health and economic returns from all these innovations, especially the digital innovations that we are implementing. I therefore, on behalf of HST, invite the Department of Health, the funders, and other partners to continue to co-create with us and scaling up digital health investment plans. We will continue to leverage our deep understanding of communities to co-create and deliver health system strengthening solutions, including digital health, in order to improve access and improve outcomes. As we proceed with this session today, I look forward to the insights that will be shared and the discussions that will help us to collectively advance digital health as a cornerstone of stronger, more equitable health systems. I thank you for listening, and I would like to call upon Ms. Vormerans, who is the Chief Director of the NHI Digital Health Systems, and she will be presenting on what her unit does or her department does and sharing with us her vision and the plans. Thank you.
So, yeah, it's still morning. So, good morning, everybody. All protocol observed. Yeah, thank you very much for the opportunity to share on behalf of the National Department of Health a few slides on the context of digital health, but also more specifically in terms of the current work that we are busy with, and also a number of opportunities that is there as we embrace digital health. So the first few slides is going to focus on generic key areas related to digital health, and then I will zoom in specifically with the key areas as it relates to the National Health Insurance. So if we look at the definition of digital health, the World Health Organization defined digital health as the field of knowledge and practice associated with the development and use of digital technologies to improve health. But there's also other context-specific definitions that we can look at. The first one is inspirational. Digital health is where clinicians and humanity meet technology to create healthier lives. And there's a lot of viewpoints on the fact that we shouldn't talk about digital health. We should talk about digital in-health, which means that digital becomes an input into the health system in terms of continuing to improve healthier lives. If we then look at the policy focus, then we can say digital health is the integration of digital tools into healthcare systems to improve quality, equity, efficiency, and outcomes. A next context that we can use in terms of defining digital health is a purely tech focus. And in that context, we can define digital health as digital health leverages data, artificial intelligence, and connectivity to transform how we care, healthcare is delivered and experienced. And this is where we start to look at Internet of Things, wearables, chat robots, etc. And that's when we have a tech-focused definition of digital health. And then for us, what is very important is the patient-centered definition of digital health, where digital health is there to empower people to take charge of their well-being through connected, personalized care and improved access. And one of the key examples, as mentioned by Ntombi, is then the CCMDD program that actually fits within the patient-centered definition. There's also a number of key principles that we need to take into consideration when we talk about digital health. The first one is about human-centered. So health should remain human-centered. And it should also always remain human-centered. Technology should only enhance and not replace empathy and trust. All of us has an experience with a healthcare professional, and it's about the relationship and trusting. And therefore, that's something that technology can't replace. If we talk about equity and inclusion, then there need to be access for all, regardless of geographic or income. So no one should be left behind, and it should be all-inclusive when we are designing, developing, considering digital health. Very important, I think all of us is aware of that, is the issue of data privacy and security. Health data is your most private data. Do you agree with me? Yes. It's more private than your bank account. And therefore, we've got the responsibility to, at all costs, safeguard our people's health data and information. And it's the most important thing to build trust in the communities to accept digital transformation. Interoperability, this is a concept that's very loosely being used. However, it's a very complex concept. It's all about how different systems are connecting with each other to seamlessly share data through a secure platform. And that's all about how your enterprise architecture is designed. It's about how you systems are aligned and the code is being developed using the normative standards that has been published in 2022 in the Government Gazette. It's also about how do we design and develop our health information exchange, which we believe should be a federated health information exchange, where different health information exchanges will interoperate with the health information exchange of South Africa in order to be able to allow us to develop the shared electronic health record. Then evidence-based innovation. We need to adopt tech that is clinically validated. A few weeks ago, I had the opportunity to be exposed to the newly developed digital health innovation hub that was established by the Ministry of Health in Ethiopia. And it's amazing the approach that they are following. And it's all about the research of ensuring that it actually addresses the problem that is there and the problem that needs to be addressed. Not a fictitious problem that somebody thought about and then suddenly decide to develop a digital solution and then want to sell it to government. But actually they're working very closely with innovators together with the government in terms of targeted digital health solutions, not only solutions, also wearables and Internet of Things and all kinds of things. So maybe I'm worried I'm going to run out of time, but I'll tell you one example. So one of the biggest challenges in Ethiopia in the hospitals was infection control. And they had a very, very high acquired infection in hospitals. So young people came and they made a proposal. And then, so first of all, the Minister of Health in Ethiopia wrote on a board the 5 things that keep him awake and said to the innovation team, this is what you need to do. Innovation need to be according to these 5 things. So the first one was infection control. Then there was a team, they presented a concept, and then they have 90 days to have the first MVP. There's another word I just can't remember now. And what they then did was, then they piloted and then they take it to scale. So what they were wearing, what they developed was a little thing, a little box that was on the nurse's pocket, and it actually flickers red every few minutes if the nurses hasn't washed their hands. And then they educated the patients to say that if a nurse comes to them and this box flickers red, they must tell the nurse to go and wash her hands. And their infection dropped with 80% in the pilot area. So obviously, it's something that you would like to take to scale. I'm just giving that as an example, and I'm already just having conversation and discussions around the possibility of developing a similar structure in South Africa. We just need finances, but there's always, if you have an idea, you should never stop with it. You should try and pursue it until every single door has closed. But maybe it was then not the right time. And the right time might come, and then you need to open the doors again. Okay, so then collaboration and co-creation, it's very important. We need to involve patients. We have to involve clinicians. And we have to have innovators. And everybody needs to be together. Within this context, we are establishing quite a number of communities of practice where we actually engage with both patients and with clinicians in terms of the different solutions that are being developed. And then sustainability and scalability. We have to build solutions with the future in mind. It needs to be solutions that can continue and be taken to scale beyond the pilot. And that often is not possible. I'll have to speed up. There's many opportunities for digital health, and I'm just going to quickly go through them. Obviously, it expands accessibility to care. CCMDD is an important use case for that, as it has expanded accessibility to care, both at the facility level where there was a decanting of patients, but also for people to get their medicine much closer to where they are. It can predict and prevent diseases through artificial intelligence and data. And this is where you need massive amounts of data with quantum computer capacity in order to be able to start working with large language models, in order to be able to move in that space. And because we in South Africa up to now have had a massive amount of silo systems, our data is all over the place. And not even all of it in the country. Some of them is even outside the country. So it's something that we really need to start looking at. And there's a huge opportunity for the health and for the patients. It improves efficiency and reduce system costs. So for every $1 you invest in digital health, you will save $32. Enables personalized and precision care, and it, very important, it improves the quality of care. The recent electronic medical record that we have beta tested in 39 facilities, it has become clear from the clinicians that using the EMR, they say because of the decision support, intelligence aligned to the guidelines that's been built into the EMR, the quality of the care they provide to the patients has improved by 90%, because they now work with the patient and deal with issues that they've almost forgotten about. And they see their patients in a much more holistic way than just coming for an HIV test or etc. And I'm not saying it, it's the clinician saying it. There's many challenges, but if we're going to get ourselves stuck in challenges, we will move nowhere. If we wait for a perfect environment, we're going to move nowhere. Important that we keep the opportunities and the principles together and work with that as far as we can. So privacy and security is very important, and that is the most important thing to manage trust. And that is one of our biggest challenges that we need to work with. I think the hackers has got, I don't know. But anyway, up to now, in the past 15 years that we're collecting information, we have never had a breach. And we've got the most private information of individuals that has been collected over the past 15 years, and we never had a breach. So we are like hawks. It's like crazy about cybersecurity. And then I did talk about we need to make sure that we close the gap between those that understand technology and those that don't understand technology, that can access the technology and those that can't access the technology. We must make sure that we don't leave anybody out. And it's very easy with all these hundreds of apps and hundreds of different solutions and technology to leave out 80% of the population in South Africa. And we saw it and we experienced it with the implementation of the electronic vaccination data system. We need to look at digital health literacy for the clinicians. The clinicians, there's a massive change management that needs to happen. That when you capture information on an electronic medical record and you have signed in as Melanie Wolmerans, it means you sign that record. So you cannot share your password. And people are sharing passwords. And that creates massive problems. Anyway, there's a way to move around it by using biometric access. But I'm just saying it's a lot of that work that needs to happen. And then building very strong governance is one of the most important things that we should not underestimate, is that digital health governance is essential. And this will address a number of the challenges that we are currently experiencing. And then the issue of digital health infrastructure, but step by step, hill by hill, mountain by mountain, we will climb them. I read the other day, it said that the mountain in front of you, it's easy to move, you move it stone by stone. Digital health transformation, it's also a term that's being used loosely. So there are 5 key areas. So the first one is where you move from paper file to a digital file. And that's where you have your electronic health record, your electronic medical record, a patient ID that replaces the paper systems. Then there's the next one is where you move from the facility to the patient, and for that you can use telemedicine, mobile apps, where you shift the care to where the people are. CCMD again is an important use case in terms of the specific digital transformation area. Moving from reactive to predictive, in other words, anticipate diseases, enabling prevention, and so forth. Move from siloed. Okay, at a stage we had a record of 74 patient information systems in hospitals and 57 patient information systems in primary health care. And wait for it, 109 mobile apps. That was all of them used in the public health sector. So it was completely siloed. So how do we move to a connected digital health platform where data is being shared through an interoperable platform? Okay, I've now covered digital health and I want to move into the NHI space. All right. So the purpose of National Health Insurance, for those of you that has not read the NHI Act, and I trust that there's no one in this audience that hasn't read the NHI Act, but don't only read the Act, also read the schedules, because the schedules refers to legislation that's already approved because the whole Act was approved, and there's huge transformation that will happen in how the health system in South Africa is designed, as indicated in the schedules, which forms part of the Act. So it is to ensure equitable access to quality and affordable health services for all South Africans. The development of a health information system has been identified as one of the key enablers for the national health insurance to succeed. And this is from managing the patient to the provider, to the health establishment, to the benefit package, to the payment, back into the planning, design of the health system, and so forth. So all of that is demanding different digital solutions that need to function on a specifically designed enterprise architecture for digital health for South Africa. And this is our current baby that we are working on. And yeah, that's how we earn our bread every day. So just to say that if you go to the Presidential Health Compact in Pillar 9, you will find that we've got 14 indicators in there. Our pillar is the most extensive, and most of the things that I'm mentioning are key areas that we are currently working on. Also, the National Health Act, Section 74, allow for the coordination of health information systems between everybody. This is how it's stated: public, private, NGO, everybody. And then the Act also, it can allow for the minister to make or to issue regulations to fulfill this in the National Health Act as per Section 90T, and that's what we are busy with now. We're going to start regulating this space. Okay. And yeah, all right. For us, the following is critical considerations. One is functionality and usability. It must be supporting the clinical workflows, and it must be user-friendly. It has to be interoperable so that it can exchange data seamlessly through the health information exchange. It must be customizable. I don't know but if we look at just HIV treatment, how many changes has happened? Now, if you design an EMR according to a specific guideline, And every time you have to pay a few millions of rands in order to redevelop the electronic medical record. You can't do that. So that's what I said when I said you need to design with the future in mind. And one of those is customizable. It must be flexible to change and accommodate expansion and growth. It has to comply with healthcare regulations and guidelines and robust security features. It needs to stand the order of reputation and support. So it has to be reliable. Training needs to be available. There has to be a help desk. Technical support needs to be available. So for the past 9 years, I think, 10 years, we received extensive support from Health Systems Trust in terms of the implementation of digital solutions in the public health facilities. And yeah, I don't know where we would have been if we didn't had that technical support. And then return on investment. Everybody wants to know, what do I get? But we should not only look at what does it cost. We should look at what is the primary return on investment, but what's the secondary return on investment? Because there's long-term return on investment. And one of the key things that we are discussing in the African Union and Africa CDC is to actually get economists in so that we can develop a return on investment model for digital health and digital health interventions. Okay, so this is what we are working on. Who received services where, delivered by whom, for what, at what cost? Very easy. We call it the equation, and this is what we need to be able to solve at all times. So the who is the person who received the service, and for that we've got the HPRS. The outpatient registration system will be regulated to become the only system for registering individuals. Okay. Where did they receive the service? What do we have for that? The Master Health Facility List. Every single health establishment in this country or community service point need to be registered on the Master Health Facility List. Otherwise, it's not possible to include that data in the shared electronic health record to allow for the portability of health services. For whom there needs to be a provider registry. For what is how we codify the benefit package. How do we codify medicine? How do we codify devices? We've published in the Gazette the intention to regulate the space. We're moving to ICD 11. We're going to implement ICHI. We're going to implement ICF. And we're going to implement coding for medicine, coding for devices, and LOINC. And we're busy negotiating with SNOMED. And we're busy purchasing health terminology services. And once we get SNOMED in, it's for the country. It's not for the National Department of Health. It is for South Africa. And we will get it for free for 1 year and then start paying the installment. And then, based on an agreement, other solutions can also use SNOMED to look at the crosswalk between ICD-10 and ICD-11. Okay, I don't think I must probably have run out of time. And I'm quickly just going, these are slides, you can look at them. I try to look at what are the technology that's available out there for each one of these key areas where we talk about the patient journey. So specifically the HPRS, this is the system. This is how we link different health records with each other in order to have a shared electronic health record. And then there's further development and opportunities, and those are some key enterprise architecture stacks that we will use from our enterprise architecture design, and then key areas that we would look at in terms of, or that is opportune to use in terms of the different technology that is available post the fourth industrial revolution. So this has been done for all of them. I'm not going to go into detail. because I think I have run out of time. It's for health establishments. It looks at prescriptions and health products. It looks at pathology and diagnostic services, and then also data services and analytics. Data services and analytics is very important. We need petabytes of data in order to start using large language models for South African environment. And therefore, we need to work together. Okay, this is my summary. I have 2 slides away from finishing. Okay, if you can look at the picture, I want to go back to 1 slide that I didn't finish. Okay, digital health systems transports data that forms the heartbeat of the health system by transforming the data into information to create intelligence. And we need to have a balance between the two. Don't collect data for the sake of collecting it. If it cannot be transformed into information to create intelligence for decision making, don't collect it. Okay, is this picture clear to you? I love this picture. Can you see the data beating through the blood? It's like the oxygen of the health system. The information systems is the oxygen of the health system, and the heart is beating it. Okay, and then we have this data, and then we create the intelligence, and then we take the decisions, and we take our people forward. Before I do my last slide, I want to go back to one that I didn't present completely. I know I'm almost out of time. Just to talk about the sections in the NHI Act that we're currently working on. Section 4 and 5 is about the population coverage and the registration of the users. For that, we've got the health patient registration system. Then there's the healthcare service coverage. This is where electronic medical records, electronic health records comes in. Then there's the accreditation of the healthcare providers, where we need to look at the digitization of the full workflow processes, where it starts from enrollment to registration, to certification, to accreditation, to contracting. And that whole workflow needs to be digitized, but also there needs to be, like for instance, a link with the Office of Health Standard Compliance, where the facility certificate is available and available to the public, because the public is going to decide who's my doctor and going to enroll with my doctor. And if my doctor's certificate says that I'm not passing any of the critical areas, the non-negotiable critical life-saving areas, then I'm not going to choose that doctor. And in building the system like that, you actually enforce quality to start moving up and people to take it serious. So contracting will also be, it's strategic purchasing, so therefore there's conditions that you need to deliver on in order to be able to being paid, and it's incentivized if you deliver on the conditions, etc. And with that, you get quality to improve. And then the last one is the section 40. You can read it for yourself, but there's 2 important points in 5 and 6 of section 40. Subsection 5 and 6. The one is that digital platform from its inception and design should prevent fraud and corruption. And the second one is that the digital solutions must allow for the portability of health services. And therefore, our current emphasis on the development of the shared electronic health record. It's a 5-year project. We are 2 years and almost 6 months into the project. Our ultimate aim is that the patient will control their record, not the clinician. The patient will allow people to see their record, and it takes a lot of the responsibility back, away from the clinician. But again, it also sort of built into that are working on quality of care, because the person can show the record to another professional, etc. Anyway, my last slide, concluding slide. Conclusion, all right. The future of health is human, powered by digital. Okay, it's not digital that's replacing humans. It is human, it's the humanity that needs to come back into healthcare professionals. And it's powered by digital because you will have more time to actually have that humanity with the patient. Together, we have the responsibility and the opportunity to shape a healthcare future that is inclusive, secure, and transformative. Let us innovate responsibly, collaborate across different sectors, and keep our patients, the people, the community at the heart of every solution. Let's build digital health for everyone, everywhere. Thank you.
All right. Thank you so much, Ms. Fulmerans. Can give another round of applause. The passion and the information as well. All right, we'll then now move on to the panel discussion. We've got 3 seats here at the front, so if 3 people could come up. No. Oh, the owners of the place are saying I'm wrong. So that's right. All right. Without further delay, I'll ask that our panel comes forward. I'll call the name and then I'll ask that they sit from the far front. So I'll start with you, Bulelani, because you're my colleague. This is Bulelani Kwane, HSS Health System Strengthening Director at HST, and then I'll ask Kat Daniels, Project Implementation Manager from Siemens, and then I'll ask Ms. Leto Gutlengobo, from the community, a user of the system, and then I'll ask Ms. Sineziwe Mazibugo, District Pharmacist from Umzinyati, and then lastly, I'll ask that Ms. Fulmerans take the last seat. We're getting into the panel discussion, and we've heard from national, we've heard the policy direction, and I think we will. I'll skip Melanie and I'll go to Sinezwe. So Sinezwe, you are from Umzinyati district, and could you kindly share with us just your perspective in terms of leveraging, the district is already rolling out CCMDD. If you can tell us of your experience, how has it helped in terms of improving healthcare in the district and also in terms of making healthcare accessible? Over to you, and you can use your mic there. You can speak from there, yeah.
Thank you so much, Chairperson, CEO, distinguished delegates. I see my former DD here. I recognize you. It's an honor to be here. Just a bit of background to provide context. I'm from Umzinyati district, which is a rural, underserved district. 93% of our 596,000 plus population is uninsured, meaning they rely heavily on public health facilities. The district is classified as socio-economic quintile 1, ranking amongst the poorest in the country. The terrain is mountainous. We have deep valleys, we have rugged roads, severely hindering access to clinics and the medicine pickup points. There's a high prevalence of HIV/AIDS, TB, hypertension, and diabetes. These are the major drivers of chronic medicines demand. Implementation of CCMDD has significantly alleviated workload on healthcare workers and improved medicine access for patients. As at the end of August 2025, we had 52,693 clients already accessing services through CCMDD, and we're at 92% of our annual targets, which we project to achieve. Key challenges for this rural community that we serve are mainly the long travel distances to our facilities and the medicine stockouts. These contribute to inequitable access. Through the use of digital health, namely the NSC, National Surveillance Center, which is used to monitor stock, the district has been able to increase medicine availability from 86% to 95% by 2020, and that is where we have remained until recently. The recent global challenges affecting medicine availability have reduced stockholding, I'm sure we're all aware, because nationally the stockholding is below 90%, and it's been below 90% for this whole financial year. KZN is no different. The stockholding is also below 90%, as at the end of August for KZN, our stockholding was at 86.8. But I'm happy to say through the use of digital health, Umzinyati is one of the 3 districts in KZN that have still remained above 90%. We ended August at 90.4%. Stockouts drive inequity. And ordinarily, rural districts are hardest hit. But through the use of RX solution in all Umzinyati health facilities, including the PHC clinics, there is real-time visibility of supplies, enhancing data-driven management. Learning from the experience of implementing digital health to improve medicine availability, the district implemented SYNC. We have rolled out SYNC in all of our facilities to manage CCMDD. This digital system is an equity enabler, as it ensures that patients, even in the most rural local municipality wards, can be tracked and traced and supported if they miss their collection dates. SYNC ensures end-to-end visibility, linking prescribers, dispensers, couriers. I see we have couriers in the house, even pickup points. In the districts that we were in, the rural districts, we mainly use pickup points like adherence clubs, outreach points, and home delivery models, even the bicycle models. All of these are on this system, ensuring that there is real-time traceability of each parcel. SYNC allows data-driven decision-making. Management teams at various levels are able to see trends in enrollment, script rejections, alignment to standard treatment guidelines that NDOH was talking about, rational prescribing, parcel collections, and missed pickups across all facilities. We discuss these management reports in the monthly CCMDD meetings that we hold, as well as the DHMT, District Health Management Team meetings, for focused interventions. The speaker next to me did say that the solution must speak to the problem. So our interventions are also focused. Reports are also utilized during the facility huddles and NEV center meetings. There's also supply chain coordination that we've realized. SYNC parcel data aligned with RX solution reports helps balance supply and demand across all health platforms. There are real opportunities in utilizing SYNC. The district has attained the first 95 of the 95 HIV cascade that we've been hearing about throughout the conference. We are currently at 97% as Umzinyati. The real gaps are in retention and viral suppression, the second and third 95s. The picture is somewhat similar to what was shared on day 1 by the Deputy President. I'm sure we also during the plenary. Maximum use of SYNC is essential in closing these gaps, as it allows easier linking of diagnosed patients across facilities and pickup points. It provides a real-time on medicine collection across multiple pickup points. I had time myself. Okay, let me go to the most important part. The most important part. When it comes to rolling out SYNC in rural districts or any digital health platform, I'm happy to say that as Umzinyati, we're also piloting EMR. So this is applicable to all digital health platforms. Network connectivity is one of the biggest barriers. Policy change can make a real difference in these settings. And I'm happy that there are national colleagues here, policy change makers. So we are suggesting zero-rated data for health systems to enable these systems to be data-free. We are suggesting offline system design so that all of these systems should have an offline functionality to ensure continuity of services even when connectivity drops, which is a common rural reality. We are suggesting dedicated and ring-fenced connectivity grants for health facilities for installation of things like VSAT where fiber is not available. We are suggesting PPPs, public-private partnerships for rural digital health. We need to create incentives, e.g. tax breaks for telecoms to extend reliability coverage to rural health facilities. And finally, we are suggesting district-level digital health connectivity targets. Just like we have the 95, 95, 95 HIV cascade, we are suggesting establishing digital readiness benchmarks for districts, e.g. saying 100% of PHC facilities must have reliable connectivity by 2026. And we measure this by having an uptime of over 90% and tie this into performance monitoring frameworks. In the words of all the speakers before me, we are not going back, but we cannot afford for the status quo to remain. Thank you.
All right, that was amazing. And thank you for timing yourself. I'm not gonna, okay, one rule, the time has shifted a bit. It's been reduced so that we finish on time and we have time for questions in the end. So next we have Miss Letoguhle Ngobo. She'll just speak to her experience in terms of using the systems that we're talking about. And over to you, Letoguhle.
Good morning, everyone. Good morning. My name is Letsogutle and I come from eThekwini Katomina Clinic. I'm very honored to be invited by Health System Trust to share my experience of collecting my medication through Pelebox, which is CCMDD. I'm a bit nervous. Yeah, I'll be fine. This is my first conference and this is my first time speaking on a panel. That's why I'm nervous. And I'm really grateful for this opportunity. So 2 years ago, I started using Pelebox, which is a smart locker system that makes collecting medicine easy, convenient, and safe. Before Pelebox, getting my medications was stressful and took a lot of time. I often had to wake up very early to reach the clinic before school or leave school early so I can queue for my medications for about 2 to 3 hours. Yeah. For a student trying to balance test assignments and personal goals, this was very difficult for me. Since I started using Pelebox, things have changed a lot. I can collect my medications at any time or even after school. So I can stay on my treatment without affecting my studies. I also get SMS reminders that can help me plan ahead and avoid last minute problems. The system allows me to choose a trusted person, which can be a community health worker or a friend of mine or a family, to collect my medicines if I cannot go for myself. And there are rules to make sure this is safe and keeps my information private. These changes have made my life easier and less stressful. I no longer have to miss school or rearrange my day for my medicine. The flexibility helps me take care of my health while keeping up with my studies. For young people like me, this means better health and more confidence to chase our dreams without being held back by collecting medications. Programs like Pelebox help strengthen health systems because they make medicine access easier, improve adherence, and can be used in many communities to reduce inequality. Based on my experience, I recommend adding more pillar box locations, improving communication through SMS and apps, and involving young people in designing and improving these digital health tools. So in conclusion, pillar box have changed how I get my medicines and manage my health. They have they have given back me to study, dream, and plan my future. I hope that with more innovation and support, these benefits can reach more young people and communities across the country. Thank you.
That was amazing. Thank you so much. All right, all right, all right. Leto, thank you so much. I think for me, it's one of the key things working for Health Systems Trust. They say all kept mentioning we are embedded in communities. And basically, that's what brings us closer. We come up, we work on solutions, co-create solutions with communities that are aimed at what Leto has just mentioned. Now, we don't only work with communities. There's also a role that's being played by private sector. We've invited Siemens Healthineers. They will speak to the role of private sector as well. A lot of the innovations, it's co-creation. So I'll hand over to you, Kat, to speak to your perspective in terms of the role of private sector. Over.
Thank you so much. Good afternoon, everybody. Yeah, I think before I even continue, I think that was so inspirational. I think these are the reasons why we wake up every day and implement innovation is because of stories like this. So thank you for the inspiration in what you just said. Yeah? So colleagues, thank you. It's indeed an honor for me to represent Siemens Healthineers here today as we explore how digital health can transform access to medicines and also how we can strengthen our health systems. Sorry. Okay. Thanks. So, yes, we would like to strengthen our health system. So at Siemens Healthineers, we believe that innovation is most impactful when it's collaborative and also scalable, right? The private sector, exemplified by Siemens Healthineers, is crucial for delivering this innovation, as well as the technical expertise and the scalable solutions to address our public health challenges. By working in partnership with government and other stakeholders, Siemens Healthineers is helping build more resilient, accessible and efficient health systems. And this is because we want to make quality healthcare a reality for many South Africans. At Siemens Healthineers, we've been focusing on different aspects within this digital environment, if I can call it that. And we've been driving large-scale digital transformations, enhancing workflows and collaboration, and also scaling access and sustainability. And at the same time, looking at reducing a lot of barriers. So when I look at these key points, a project comes to mind where we've worked with the Department of Health in Gauteng. And we've been working with them for quite a while, and we've been working on modernizing radiology and imaging services for more than 30 plus facilities across Gauteng, and that's from academic through tertiary, regional, district clinics, where we're modernizing radiology services. So this project really enabled us to securely, within a cloud environment, store medical images as well as reports. Now you might ask, how does that help us? Yeah? But this is what is helping us, is making these reports and images accessible to clinicians across various and different facilities. Yeah? So that's basically the driving of this large-scale transformations. When we look at workflows, we are, by deploying these digital solutions, we can improve workflow efficiency. We've enabled things like cross-site reporting, where we allow clinicians to consult with each other in real time, and also regardless of the location that they're at. So it doesn't only streamline operations within radiology, but it also allows and accelerates diagnosis and also the treatment of patients. So when I look at the scaling and sustainability of the solutions we provide in this setting for this project, the data volumes have increased significantly. We are storing tons of data, and I was so encouraged sitting there listening to Mrs. Wolmerans and thinking that a lot of the points that she's raised, we already covering in what we're doing. You know, the siloed approaches. We have done integrations with HIS and the various things that is making all of this come together. So in terms of data, we're storing large amounts of data, and what's good about this is it's accessible across the province of Gauteng. I think one of the big things where we're trying to reduce barriers is in terms of what this digital solution helps us with. We're reducing the need for film. I'm sure all of you can remember the big film, the light box. Yeah, it's becoming a theme of the past. And especially when we're doing it on a large scale, like with the Department of Health in Gauteng. So it's also reducing, and by reducing the need for film, we're reducing cost. I'm sure you can imagine that. And also, it's available then to even places where there's resource limitations. So I think as we look forward towards the future, Siemens Healthineers is deeply committed to the digital transformation of healthcare in South Africa. Our experience has shown that what is possible when partnership, innovation, you know, and expertise come together to actually deal with real-world challenges. We aspire to bring our proven digital health solutions to every corner of our country, ensuring that all South Africans, regardless of their location, have access to high quality, efficient, and connected healthcare. Thank you.
All right, Bulelani, I'll give you 4 minutes. Because I still have to come back to Ms. Wolmerans, at least I'll pose one question and then yeah. So, Health Systems Trust has been working in this space for a while as an NGO. And it'd be nice to get perspective from you in terms of the experience that you've garnered and any insights that you can provide. And for me, this is the whole point of having these discussions, understanding where each one of us fits in this puzzle and also how we complement each other. Over to you, Bulelani.
Yeah, I knew that you were going to sabotage me. Good afternoon, everybody. Look, I think as Health Systems Trust, partnership is important, and I think that is clear from here that we can't work only alone. We have to work with other partners to develop these digital health tools and systems. And our partnership with the Department of Health has really been very key, both at the national and the provincial, even at the district level, has been really very important. And as you would know that in rolling out SYNC system, which supports the CCMDD program, we have worked across all provinces, of course, except for the Western Cape. But all other provinces have really come to the party, and we've been working very well. And you can hear from Zinyati how that has really helped them. But if you really know that the CCMDD program largely has over 5 million people in the country, and about 65% of those people are on the SYNC system. And I think that it's really an important tool that can really also help us with decision making. As you know that we develop some of these systems with funding from donors, and I think that as the foreign aid disappears, we have to look at other sources. And I'm glad that the private sector is here, and that's why we're trying to see how we can tap onto other sources of funding. just to also talk about our experiences in rolling out pallet boxes or the e-lockers or smart lockers in KZN. We have about 30 of these smart lockers in 4 districts. And of course, eThekwini being an economic hub, there are more in eThekwini because of that convenience that I think has been spoken about, to make sure that those that work and those that that go to school can be able to access their medicine. There are over 68,000 people who are accessing medication through the smart lockers. As HST, we also have been working in the 4 districts that we are supporting in KZN to also kind of roll out mobile CCMDD vans, you know, to take the services to the people. And we have over 14,000 people who are accessing their chronic medicine through these mobile vans. I think that all of these experiences have actually kind of taught us that we need to think about the communities. We need to make sure that the solutions that we are designing are to improve the health outcomes. And I think that there's already evidence that what we are doing is really improving the health outcomes. Of course, importantly, is that we need to make sure that these systems are integrated and they speak to each other, and that all of these systems that are already developed, how do we make sure that they can coexist, but also making sure that we are aligned with the guidelines that Ms. Voramans has already spoken to. But we are really grateful about the partnership and the ability to be able to work with the Department of Health. Thank you very much.
So it's Valmarans. Point of correction. So, okay, thank you so much. And I'll come back to you. I think you have listened, you've given a lot of insights, and you've listened to everyone. Just in terms of the future, NHI, are there any insights that anyone in this room you'd want to take home with in terms of anything that you find important? Go. You have the mic.
So for the moment, I think we need to, there's 2 things. The one is that NHI will be built on a digitized platform, and therefore will save immense administrative costs, which currently is very huge in the current system that we are implementing. That's the first thing. The second thing is who received services, where, delivered by whom, for what, at what costs. And this is the formula that we need to work on. And any digital solution need to actually fit within those, either 1 or 3 or 4 or all of the building blocks, because that will give us an integrated health information system where we are planning and take decisions on patient-based data. But as long as we've got silo systems, not using unique identifiers, we will never, ever reach it. Thanks. Can I say one last thing? Okay, so the National Department of Health, together with the CSIR, has published a book. It's an academic reference book. It's called the Emerging South African National Health Information System, the Strategies, Approaches and Experiences. And just to say thank you to HST, they also have contributed to the book, and we're busy planning the 2nd book to be published or to be available in 2026. The decision is that there's an immense amount of good work that we are doing in South Africa, but we're not writing it up. So if you haven't written it down, it never happens.
All right. Yeah, can you give a big round of applause to our panelists? Right. I think at this point, it's meant to be a session, and people should be asking questions. So I'll invite, if you have a question, okay, I see one hand. Can someone come to the roving mic? All right. In front of you, sir.
Thank you very much to the speakers. I'm Jenny Nash. I'm a family physician
All right,
from
can I
Eastern-
ask, sorry, if you're asking a question, can you stand? And the camera people want to see you, so.
Good afternoon, thanks very much. I'm Jenny Nash, I'm a family physician from the Eastern Cape. I remember being in HPRS training a few years ago with Vomerons and being absolutely amazed at what was being planned, and it is truly amazing what's been happening. My question really is around collaboration within the department, and we've just been to a meeting last week with NDOH in Pretoria where we heard that different departments aren't talking to each other. And my concern around this digitalization is just collaboration with other departments. So I'm from a district with lots of rural clinics. We need connectivity, we need solar, we need security. We're losing lots of our computers due to security. And are we talking to different sectors to try and protect these assets? And how are we talking to Home Affairs that we're able to register grants, SASA grants, etc. So it's not just health at these facilities. Thanks.
All right, can I ask that I take 3 questions and then we come on to the answers? I think I see 2 more hands.
Thanks very much for the presentation. I'll simply just to add on what you said. As much as we are moving to an era of digitalizations, can the systems that we are having talking to one another, I'm talking from a service delivery point, consulting room 1 having a computer does not communicate with consultation 2. If that has not been met, what we need to achieve, it will be a problem. So if as much as we are emerging and want to digitalize, let's have a network system that the whole facility from reception up to the end product, which is the pharmacist, needs to communicate. Because the dispensing, the multiple consultation, it happens in one facility. I consult to this sister, and when I go out, I'm having this package, and I was in a queue with my friend, and I'm seeing my friend, it's having something, and when we were talking, we might be presenting with one and the same thing. I would like to be given what my friend has been given, or my friend will recommend Sister X in room X. It's better than Sister X in room 1. Then I become a new client in the same facility, and I will be counted what? Twice. And I will be given medication how many? Twice. So that it becomes a burden to the health system for those that are at decision making in terms of budgeting, in terms of costing. I'll cost for 1 or I'll cost for 2. Then at the end, we are having a challenge. Then the next thing, this one is having this one. So we are saying as much as we are innovative, creative, the current system that is there, let it talk to one another. Then we'll eliminate all the issues that we are having. Thank you.
All right. Do we take one more question before the responses? Yes, go ahead.
Greetings, everyone, and thank you so much for from our presenters. I am Nompumelelo Khoza, pharmacist from Oram, based in Bujanala, Northwest. I have 2 questions. The first one goes to our lady who is presenting Ipele-box. I will call it presenting Ipele-box. Thank you so much for your experience. One question that I have, and I wish we could have that your information going in all the districts that have Belle boxes. But one question that I have for you is just to check what will be your advice to the patients that are still feeling like collecting from Belle box? It stigmatizes them. They are scared of collecting from Belle box because of the stigma attached. Because we have one of the areas where patients, they don't want to collect from the ballot box. They even ask the staff members to load their parcels and remove them for them to collect it from the facility, which end up defeating the whole purpose of having the ballot box within that facility. And then my second question, I just want to check in KZN, how are the users of the system accepting the system? Because we've had a lot of pushback from most of our facilities where they feel like using Sync, it's an extra activity that they have to do. For them, they prefer just prescribing on the file and then that's it. But we end up with a lot of patients being dormant and end up being closed, yet they are not true dormant. Thank you.
All right, okay, thank you. I think we'll keep it here and get the responses. Milana, I don't know if you want to be the first to respond. I think you have two questions. I think the first one is collaboration within the department, and the second one is our systems not communicating with each other within the same facility.
Okay, thank you for the question. I'm not sure which meeting you refer to. We are working together, but it is an age-old challenge since I was working in facilities. However, we are working very closely with the Department of Home Affairs to the effect that the HPRS now is doing biometric identity verification, and it is within seconds, but you require connectivity. Okay. We are having projects with the Department of Home Affairs where if you type in the ID number of the patient, it will go to Home Affairs. The demographics of the patient comes back, populate the HPRS. You just confirm that the information is correct, and it sends the photo that that Home Affairs has on record. There is a lot of potential for the country to improve the population register, to have this collaboration between health and Home Affairs, because you open your eyes in health and you close your eyes in health. So we are nurturing that relationship and we are working very closely together. With regards to the Department of Communication and Digital Technology, we do have a link, but it depends on how do we see digital health. If we see digital in health as the concept, or do we see it as ICT? And we need to do a lot of advocacy for digital health in the broader context, for people to realize and see the benefit in order to support. So that's what we are working on. But just to say that HPRS is zero rated. The electronic medical record that we will start to roll out as from February to all primary healthcare facilities in the country is zero rated. The issue with zero rating doesn't mean you don't need internet connectivity. You still need an internet service provider, because like with your phone, then they say there's an update. Nee? Your operating systems need to update on a regular basis. But there's good lessons to learn, and we're exploring and engaging, for instance, with security. Somebody came up with an idea to say, but there is a concept of what they call tablet racks, where it's a rack that's bolted to the wall of the facility. You literally need to break down the wall in order. And then tablets are being put in that rack. And only the person that the tablet has been assigned to have a code to release that tablet. But then during the night, it also charges. And if the facility has got connectivity, it will then also during the night update the operating systems. So that's one that we are currently working on testing. There's also in the hospitals where they were asking us to have mobile computers. Instead of having a computer at a station, And also the risk of the tablets in hospitals is bigger than in the primary healthcare facilities. They ask for computers on wheels, and we're also testing that solution as well. So the point is, the more we think about ideas to improve, the better. Okay, in terms of, I agree with you 100%. I've been in a facility where, in a primary healthcare facility, literally with 4 consulting rooms and 1 keyboard and 1 mouse. But there's a box and a screen in each one of the consulting rooms, but there's only 1 keyboard and 1 mouse. So when they try to look up on TrackCare lab results, somebody must run and bring the keyboard, and then the keyboard moves from one consulting room to another. That is inefficient. We need to make sure, and there is policy decisions that we need to take. For an example, where there's facilities, one area where there's one specific facility where almost all the computers has been stolen. So the decision was then to work with assigned laptops. So the laptop gets assigned to an individual, and that individual is responsible to look after that laptop. So there are these things, technology, there's always solutions, but there's not a one shoe fit all for the technology solutions. And that's the enabler for digital health. So we are working together. Oh, the other thing that I want to talk about is that the President has established a digital health stream as part of Operation Vulindlela that's working on 3 critical areas that is going to revolutionize digital health in South Africa if that comes to into play. The first one is digital identity. The second one is digital wallet. And the third one is digital public infrastructure. So digital public infrastructure is a secure code. So they call it cryptographic signatures, where it costs lots of money. But you can then have your own health wallet. And in that health wallet, you can even travel abroad with your health wallet. And then there's a cryptographic signature. And if the keys has been shared with another country's embassy or whatever, they can open your health record to give you the medicine that you have lost or that fall from the boat and so forth. So the future is amazing in terms of these key things going forward. I can talk forever.
Yeah, and I think we've got about 90 seconds.
Thank you. Can I take the
Yeah,
one,
please do.
the last one? Thank you, about the system uptake in KZN. Maybe what I can say briefly is that I think it all rests on leadership and governance. In KZN, CCMDD falls under the leadership of the Chief Director, District Health Services, Mr. Mdebele, who is very active. So CCMDD is part of the agenda item in all strategic meetings. And there is very close monitoring of all of the operations. And when gaps are realized, like with the SYNC training, it was realized as one of the gaps, then supporting partners get roped in to provide the training. Last year, HST provided the training for the whole province. So it's just at the forefront of our minds because of leadership. Thank you.
Yeah, just to respond quickly around the issue of the stigma. Yeah, of course, it's always going to be difficult, but we also know that the dispensing of the medicine in the pillar box includes other chronic medicines. So I think that's probably how we can kind of promote it and make sure that people know that this is not only HIV medicine. You can get your hypertension, you can get your diabetes and all of that. And it might also be how we brand the pillar box. You know, we must also try to be as creative as possible to make sure that there's an opportunity to kind of write some messages in the actual pillar box or around the pillar box to make sure that the take-up is as good as it should be. Yeah, thanks.
All right. I think we are. Oh, Leto, do you want to say something?
Yeah.
All right.
To add on his point, I think you should have self-respect and you mustn't listen to other people what say, because at the end of the day, mele uzithande, love yourself, and at the end of the day, people will talk. People always talk. Yeah, and Pele Box is a safe machine and it's time consuming to all of us. And it's an electronic machine that assists in different medication that are prescribed in the clinic. Yeah. Hashtag zithande.
Right. And thank you, Letogohle. I think at this point, it's first of all to pass our deepest and profound thanks to all of them, the department, the districts and private sector, Leto from the community, and Bulelani, and also Kat from private sector. As also special thanks to HST, all the colleagues who worked to put this together. Siyabonga, and have a good day.